Everyone, my name is Tracy Joshi, and I am a nurse practitioner at the Boston University Amyloidosis Center, and I specialize in amyloidosis. Today, I'll guide you through what amyloidosis is, how it affects the body, and how it's diagnosed. My goal is to make this information easy to understand and help you feel confident about your diagnosis and treatment journey. So amyloid is not just a simple substance, but rather a group of proteins that can sometimes fold the wrong way. When this happens, these misfolded proteins can build up in organs and tissues, leading to a condition called amyloidosis. It's important to know that amyloid proteins are not typically harmful, but when they misfold, they can cause significant health issues. Normally, proteins in our body perform vital functions, like building tissues and supporting our immune system. However, in amyloidosis, certain proteins misfold and clump together, causing damage wherever they accumulate. This buildup disrupts how organs work and can lead to serious health problems if not treated. Think of your organs as a sturdy brick wall. Healthy proteins are like well-made bricks that fit perfectly. In amyloidosis, some bricks are misshapen and don't fit properly, weakening the wall. Over time, this can cause the wall or your organs to struggle to function properly. Amyloidosis is a condition where misfolded proteins called amyloid build up in the tissues and organs. These deposits can affect different parts of your body, such as the heart, the kidney, the liver, nerves, digestive system. The impact depends on where the amyloid builds up and how much is present. There are several types of amyloidosis, but the most common types include AL amyloidosis related to bone marrow producing abnormal proteins. ATTR amyloidosis involves the transthyretin protein, which can misfold due to aging or genetics. AA amyloidosis, usually a result of long-term inflammation. Localized amyloidosis, where deposits are confined to one area, like the skin or the bladder. Understanding the type of amyloidosis is the key to choosing the right treatment. The type of amyloid determines the type of treatment, so accurately identifying the type is essential for effective management. Amyloid can affect different parts of your body, depending on where the amyloid proteins build up. For example, when the amyloid deposits in the heart, it can lead to heart failure or irregular heartbeats. In the kidneys, it may cause protein loss in the urine and eventually affect the kidney function. If amyloid affects the nerves, you might experience tingling, numbness, or feeling like pins and needles in your hands or feet. In the digestive system, it could cause issues like diarrhea or difficulty absorbing nutrients. The challenge with amyloidosis is that symptoms can mimic other conditions, which is why it can take time to get the correct diagnosis. One of the biggest challenges with diagnosing amyloidosis is that there is not a single test that can give us a quick answer. Instead, we need a combination of tests to build a complete picture to ensure we are accurately identifying the type of amyloidosis and its impact on your body. Healthcare providers typically start with blood and urine tests to check for abnormal proteins and evaluate how well your organs are doing. From there, they might recommend imaging tests, which can show how organs like your heart are functioning. In some cases, a biopsy, a small sample of tissue, may be needed to confirm the diagnosis. All these pieces of information help us identify not just if amyloidosis is present, but also what type it is and how it might be affecting your body. Once amyloidosis is suspected, the initial screening often starts with blood and urine test. One critical blood test is the serum-free light chain assay, which measures the level of light chains in your body. These light chains are part of your immune system's antibodies, but in amyloidosis, especially AL amyloidosis, these proteins can misfold and form harmful deposits. We also look at immunofixation electrophoresis for both blood and urine. This test can help detect any abnormal proteins known as monoclonal proteins or M proteins, which can be a sign of amyloidosis. These initial tests are like the first clues in a mystery. They don't confirm the diagnosis on their own, but they help guide the next step, whether that involves imaging, a biopsy, or more specific testing. By combining the results of these blood tests and urine tests, we can determine if amyloidosis is a possibility and what kind of further testing we might need. When diagnosing amyloidosis, it's important to assess how different organs might be affected by the amyloid deposits. This involves a range of blood and urine tests that provide valuable insight into organ function and potential involvement. A complete blood count helps detect signs of anemia, which can occur if amyloidosis is affecting your bone marrow. A complete metabolic panel assesses your kidney and liver function. Troponin, BNP, or NT-proBNP, these biomarkers are crucial for evaluating heart involvement. Urinalysis and 24-hour urine check the kidney's function, particularly looking for protein in the urine known as proteinuria. Proteinuria can indicate that amyloid deposits are affecting the kidney's ability to filter waste. These organ screenings tests allow for your health team to understand the extent of the organ involvement. This understanding is critical in tailoring a treatment plan that addresses both amyloidosis and its vital organs. Once amyloidosis is suspected, imaging tests play a crucial role in evaluating how the condition may be affecting the heart. An echocardiogram is an ultrasound of the heart that uses sound waves to create images of how well your heart is pumping blood. It can identify thickened heart walls, which is a key feature of cardiac amyloidosis. It also helps assessing heart function and to detect signs of stiffness or restrictive cardiomyopathy, which can occur when amyloid infiltrates the heart muscles, causing it to become less flexible. A MRI, particularly a cardiac MRI, provides highly detailed images of the heart muscle, useful for detecting amyloid deposits and assessing heart function. A technique called late gadolinium enhancement can help distinguish amyloid infiltrates from other heart conditions, giving us a clearer picture of what's happening inside. The technetium pyrophosphate scan, or a PYP, is a specialized nuclear imaging test used primarily for the diagnosis of ATTR or transthyretin amyloidosis. During this scan, a small amount of radioactive tracer is injected into the bloodstream, which then binds to the amyloid deposits in the heart. What makes the PYP scan particularly valuable? In some cases, it can diagnose transthyretin amyloidosis without the need of a biopsy, as long as blood and urine tests rule out AL amyloidosis. This can make the diagnostic process less invasive and quicker for patients. These imaging tests not only help confirm the presence of amyloid, but also can provide essential information about how well the heart is functioning. One of the most important steps in diagnosing AL amyloidosis is obtaining a tissue biopsy. While some other types of amyloidosis, like ATTR amyloidosis, can often be diagnosed by the PYP scan, AL amyloidosis and most other forms require a biopsy to confirm the presence of amyloid deposits. A biopsy involves taking a small sample of tissue from the body to be examined underneath a microscope. This helps confirm the presence of amyloid and determine the specific type of amyloid protein. There are many places a biopsy can be taken, but you only need one to confirm the diagnosis. An abdominal fat biopsy is a simple, minimally invasive procedure where a small sample of fat is taken from the abdomen. This is often the first choice because it's low risk and easy to perform. A bone marrow biopsy. Since AL amyloidosis starts with abnormal plasma cells, this biopsy helps detect any blood-related issues, and plus, amyloid can deposit inside of the bone marrow. If amyloidosis affects the heart, a small tissue sample can be taken from the heart muscle to confirm the amyloid buildup. When protein is found inside of the urine or kidney function is worsening, a kidney biopsy can determine if amyloid is affecting the kidneys. If blood tests suggest changes in the liver function, a biopsy can check for amyloid deposits in the liver. Amyloidosis can affect the digestive system. In these cases, a biopsy may be done during an endoscopy or colonoscopy to check for amyloid buildup in the digestive tract. In some cases, a tongue or rectal biopsy historically may be used. The type of biopsy depends on which organ is affected. The specialist managing that part of the body will determine the most appropriate biopsy method to confirm the diagnosis. Once we have confirmed the presence of amyloid in the biopsy, the next critical step is protein typing. This step helps us determine exactly what type of amyloid protein is involved in your condition. The gold standard for protein typing is mass spectrometry. This advanced laboratory test analyzes the biopsy sample and identifies the exact amyloid protein present in your tissue. Mass spectrometry is widely used because it provides the most accurate and detailed results. By confirming the specific amyloid type, allows us to choose the best treatment plan for your case and target the right protein. This step ensures that we are going to use the right treatment at the right time for your right condition. Now, living with amyloidosis is a journey that involves ongoing care, symptom management, and in some cases, long-term treatment. While the diagnosis may feel overwhelming, there are many ways to take control of your health and improve your quality of life. Being diagnosed with a rare condition like amyloidosis can be emotionally challenging. It's completely normal to feel worried, uncertain, or even frustrated. But you are not alone. There are people who understand what you're going through. Connecting with support groups can provide reassurance, practical advice, and a sense of community. Talking with others who have been through this journey can help ease feelings of isolation and offer encouragement. One of the most empowering things that you can do is learn as much as you can about amyloidosis. Understanding your type of amyloidosis and its treatment can help you feel more in control of your health decisions. Managing amyloidosis is not just treatment. It's about living well despite the diagnosis. Surrounding yourself with the right medical care, emotional support, and knowledge can make all the difference. You are more than your diagnosis, and with the right tools and support, you can continue to lead a meaningful, fulfilling life. While amyloidosis is a serious condition, the good news is that advancements in diagnostic and treatment are giving patients more options than ever before. By understanding your diagnosis and working with your healthcare team, you're taking the first step towards managing your health. If you have any questions or want to learn more, I encourage you to reach out to your doctor or explore trusted resources from organizations like the Amyloid Research Consortium. Thank you for taking the time to learn about this important condition.